The rib cage is an essential part of the human skeletal system that protects the thoracic organs, including the heart and lungs. It is formed by the sternum, breastbone, 12 pairs of ribs, and 12 thoracic vertebrae. Each rib has two parts, a head and a tubercle. The head of the rib articulates with the thoracic vertebrae, and the tubercle articulates with the transverse process of the vertebra. The first 7 pairs of ribs, also known as true ribs, attach to the sternum directly through cartilaginous extensions called costal cartilages. The remaining 5 pairs of ribs, also known as false ribs, either attach to the sternum indirectly or do not attach to it at all. The sternum is a long, flat bone in the center of the chest that connects the ribs through cartilaginous extensions. The sternum consists of 3 parts: the manubrium, the body, and the xiphoid process. The manubrium is the broad upper part of the sternum, which articulates with the clavicles and the first rib. The body is the long middle part of the sternum that articulates with the costal cartilages of the 2nd to 7th ribs. The xiphoid process is the small, pointed lower part of the sternum that does not articulate with any ribs and is made of cartilage in children, but becomes ossified with bone in adults. True ribs are the first 7 pairs of ribs that attach to the sternum directly through cartilaginous extensions called costal cartilages. False ribs comprise the next 5 pairs, which either attach to the sternum indirectly through the costal cartilage of the rib above or do not attach to the sternum at all. The last 2 pairs of ribs are known as floating ribs because they do not attach to the sternum or any other bone.